This is a relapse case of someone who had a very large overjet. Now, 4 years post-treatment, some anterior spaces have developed. Now, I'm not showing you a cephalograph, but you can notice that the upper teeth have a slightly forward inclination. You certainly would not call these teeth upright or leaning in. Now, we don't have a lot of space to close, which makes this a very favorable situation. We have a total, if you ignore, let's say, the premolars, we have 0.5 here. We've got about 1.5 millimeters of space. If this were an extraction case where we had a huge space that we had to close, we might be concerned as we retract these teeth back to the extent required to close a 7 millimeter space that the teeth would tilt or tip in too much. And therefore, we'd have to worry about having palatal root torque built in so that we don't dump or tilt those upper teeth in. But in this case, we only have a total of 1.5 millimeters of space. So here's one of, I think, my secrets to predictable results with Invisalign. If you look at how these teeth are being retracted on this touch-up case that I just sent in, this was the first clincheck that came back, and you notice the teeth are moving bodily. The way you can sort of tell this, other than just by eyeballing it, is if you look at the palatal aspects, the gingival margin, you see how those are moving in. If you look at the facial surface of the teeth, you see about the same amount of tooth structure. If I hold it like this, you won't see the gingival margin up here. And you can also notice, looking at it this way, if you recognize how teeth move, these teeth are moving in a bodily format. Now, you might want to program that as a form of overcorrection to prevent tipping. However, when you do that, you're making a more complex movement because you're trying to move the tooth and the root at the apex, and there's resistance to that. You can get anchorage loss from that. And you could just have a less predictable Invisalign treatment when this is a simple case. So what I do is I just make the modification myself. So let's modify. And now what I do is I take this, I take the root torque tool, and I remove the root torque. I just eyeball it at first. And now I want to see, after my adjustment, are my teeth moving in a more tipping way? So you can kind of see, look at the gingival margin of upper right one. You can now just about see the gingival margin, and here you can't. And you can look at it in this view, and you could see clearly more movement at the incisal edge than at the gingival margin, which means we are not programming a bodily movement, because I don't think we need it in this case, and we'll have an easier, predictable time. Adjustments like this can really make Invisalign much more effective. If it's a complex case, of course, the clincheck design is critical, but even in a minor case like this, clincheck design can make a huge difference. I also, by the way, don't need any of these attachments. I'm going to take those off. I'll make sure, if you look at that extrusion of that lateral, I'll make sure that I don't extrude it quite as much. This way, I don't need the attachment. And when you look at it, you want to eyeball and make sure that you still have a nice cosmetic result without that. And by the way, there's actually a little too much buccal root torque. I might have overdone it. So I just kind of go back and forth. And there we go. Let me push this back a little bit more. All right, tipping movements, much easier.